Hi, I'm Dr. Aimee Colbath from Cornell University College of Veterinary Medicine. Today we're going to do NanoNeedle standing arthroscopy of the cervical articular facet joint between the 5th and 6th cervical vertebrae. We're using the Arthrex nanoscope system and the new NanoNeedle Scope. Let's get started. The articular facet is identified on ultrasound in the longitudinal plane. The sharp trocar is ultrasound guided into the facet joint and replaced with a NanoNeedle Scope. The horse's skin over the site is blocked. We are getting some bleeding, which is not uncommon for this procedure. But when we have the fluids going, you can see the cartilage of the articular facet. Despite some bleeding at the site, we can see the caudal aspect of the cervical facet to the left and the cranial cervical facet to the right. One very nice aspect of this scope is that despite the addition of fluids into the surgical site, we are getting very little fluid extravasation around the scope site. There is no swelling in the subcutaneous tissues, and there is a very small entry portal with no need for suture closure, or a single suture closure if you prefer. And so we could scope the cervical articular facet, and this horse can go back to its stall with essentially a needle puncture-sized hole in its neck. Using the NanoNeedle, we were able to assess the articular facet between the 5th and 6th cervical vertebrae in the standing horse. Thank you for watching.